Hi all, today we are going to learn about D-dimer. What is D-dimer? It's a blood test that measures the D-dimer level in the blood. And what is it? It's a protein fragment or small protein formed in the blood when a blood clot breaks down. D-dimer is also called fibrin degradation product. So if you look at the clotting mechanism, whenever there is trauma or injury to the blood vessels and bleeding happens, platelet aggregation happens, which is followed by fibrinogen in the blood gets converted to fibrin. This fibrin acts as a mesh which traps, it's a mesh that acts to trap the WBCs and RBCs and forms the clot. Once the clot is formed and bleeding stops, the fibrin formation is followed by fibrinolysis, that means breakdown of this fibrin. And when fibrin breaks down, D-dimer is formed as a byproduct. So increased D-dimer level in the blood is due to the presence of a blood clot. So what is D-dimer test used for? It is used to rule out a blood clot. It can be DVT, that means blood clot in the vein, especially in lower legs, pulmonary embolism, blood clot in the pulmonary artery, stroke, DIC, that is disseminated intravascular coagulation, that means presence of multiple blood clots in the blood vessels. But the disadvantage of D-dimer test is it's not specific. That means it doesn't show where the clot is, and there are many multiple conditions that can cause false D-dimer positive. So if a patient has a D-dimer positive or increased D-dimer, the physician has to order more tests to rule out the blood clot. Example, venous Doppler to rule out DVT, that means venous Doppler of the legs, or CT angio of the chest or VQ scan to diagnose pulmonary embolism, etc. Positive D-dimer is also seen in COVID-19 patient due to the presence of increased risk of blood clot formation. So D-dimer test is used as a marker to judge the severity and the prognosis of COVID-19. Now let's see what are the normal level of D-dimer. D-dimer is reported in FEU or DDU, that is fibrinogen equivalent units or D-dimer units. If it is FEU, the normal level is less than 500 nanogram per ml FEU, or if it is DDU, the normal level is less than 250 nanogram per ml. So when you interpret D-dimer level, it's important to know the units in which the D-dimer is expressed. And also when you interpret, you should also know there are certain conditions that can cause false positive D-dimer. So false positive can be associated with any time whenever there is a trauma or inflammation on the body. So false positive is seen in hospitalized patient post-surgery, whenever there is a trauma, inflammation, pregnancy, malignancy or cancer, when there is a liver disease or MI. So today we learned about D-dimer, and thanks for watching my video.